This report brought to you by the Richmond Club, where investors and high-growth companies meet.
Our next speaker is the President and CEO of Nova Leap Health Corp. Please welcome Mr. Chris Dobbin.
Thanks, Greg. Appreciate the opportunity to speak again. This is probably a bit of an update for some of you. I think I was here last February and recognized a number of faces in the audience. I'm between two resource companies, so perhaps I could be your resource for home care, because we are a home care business, and that's the industry in which we operate. So Nova Leap Health Corp. So just by way of how I started the company 3 years ago, some of you may recall my father-in-law had been diagnosed with Parkinson's, and the last couple of years of his life we have home care as a family for him. And it was a really, really good experience, unique experience. We learned a lot from it, and we saw a gap in the market, particularly with dealing with people that live with dementia. And so I started Nova Leap Health Corp back in 2016, went through the CPC process with a clean shell, and have been quite active in rolling up home care companies primarily in the New England and Nova Scotia area. So I'll talk a little bit about what we've done. So what do we do what do we mean when we refer to home care? We often hear two interchangeable terms: home care, home health care. Home care typically refers to the non-medical side. So think about that as dementia care, companionship, light housekeeping, meal prep, transportation, errands, medication reminders. Home health care is usually referring to the medical side of things. So wound care would be an example of that, or a med push would be another example. So our business is primarily on the non-medical side of things. About 95% of our business would be purely non-medical, and so we're really a home care type of business. In terms of the industry, it has been one of the fastest growing industries in Canada and the US for the last several years, and should continue to be so over the next several years, and that's driven by demographics. We have an aging population, and the reality is people need help at home, and that's the service that we provide. What's driving the opportunity? We focus primarily in the US, and I will say we're not in the Medicare and Medicaid space. We're a private pay type of agency model. So we bill our clients on an hourly basis, and then 85% would be pure private pay or out of pocket by those we provide the direct service to or their adult children, and the other 15% will be a combination of veteran affairs or long-term care insurance. So that's our model. So we're not impacted by the changes that happen in the US through Medicare and Medicaid. How have we done? It's been an exciting 2 years, I'll be honest. 2 years ago we had 10 employees, now we have 700. 2 years ago we had $40,000 of annualized revenue. Now we're north of $17 million. We're coming off Q2 results where we've reported record revenues, record gross margin percentage, record operating segment EBITDA, record operating segment EBITDA percentage, record operating cash flows. Every quarter for us, we set new records, and that's the way it's been quarter after quarter, quite honestly, for the last 8 quarters. So we've come a long way over the last couple of years. It's been a fun ride. We have a long way to go, as I'll show you in the maps in a little bit. I do get questioned about organic growth. We are an acquisitive company. We buy companies. We've made 8 acquisitions over the last 8 quarters in Vermont, New Hampshire, Rhode Island, Massachusetts, and Nova Scotia. We will continue to acquire. We are an acquisitive company, and a large part of our growth going forward will continue to come from acquisitions. But we can also grow organically. We've done a really good job of that, and we've looked at 2 factors. One is what we call our net service margin. So we bill our clients on an hourly basis, and we pay our care professionals on an hourly basis, and so there's a margin every hour that we work. And that's been growing organically just over 10%. And from an EBITDA perspective, you think about what we're doing is we take these multiple companies and we put them onto a larger platform, then there are efficiencies that we can gain in a number of different areas, including the leverage of technology that ties our scheduling system into our billing and payroll systems or our accounting functions. And that's led to a dramatic increase in what I consider to be organic EBITDA growth. And I use that because we have very little, if any, CapEx. We have one vehicle in the company, and we have a building worth $90,000. So really no CapEx whatsoever, and very little taxes. So it's a reasonable metric for us to use, and that's grown organically by 64%. So it's one thing to be acquisitive. It's one thing to go out and acquire a lot of companies. But what we've done is we've identified small businesses. They have a great track record. They're 10 to 15 years old. They're historically profitable. They have a good management team or operating team in place. And we keep that team post-acquisition. And we help them. And we challenge them to grow. And they take on more responsibility. And they've done a fantastic job of that. It's no fluke that we've been successful in putting 700 people together over the course of 2 years. It's very difficult to do, and we've done a great job. It really a credit to the people that we've been able to work with. How does our EBITDA growth work? Again, as you scale up from a pure startup, obviously then you have infrastructure cost and a cost of being public. And so we're at the point now where we've been reporting on a quarterly basis positive EBITDA results. And so we've hit that inflection point where we're starting to generate some real strong numbers on a quarterly basis. As I mentioned, quarter over quarter record results for us. So what's our strategy? We're really a three-pronged strategy for us. One, we'll continue to acquire. We like the Northeast. We'll continue to acquire there. We've just made an announcement going to South Central. It'll be the first time that we're going into a different area of the U.S., and so we're looking forward to that. It's a deal we've announced. It hasn't closed yet. It's under contract. We're just finalizing our due diligence. Two, we will continue to grow organically. And for us, organically is really looking at the operations that we have and expanding into other areas into a state. So we make an acquisition into a state, which we've done, then we'll look at the other areas within that state where we can open a brand new office. And that could be going into a small medical arts building, for example, with a small footprint, hiring a registered nurse or licensed practical nurse, or someone with a geriatric care background. And that individual then is responsible for usually an hour radius. That's about the radius that makes sense from a geography perspective. And so that's a new area for us. That would be an example of organic growth. Joint venture partners, we look at that. We can do that either with an existing agency where it makes sense, or we can partner potentially with hospitals in the U.S. The model in the U.S. is quite different than what it is in Canada. A little bit harder to partner with hospitals in Canada, but in the U.S. they're often owned by private equity firms or high net worth individuals, and they're incentivized through the Centers for Medicare and Medicaid Services, CMS, to work with companies like ours because of the specific criteria that they have to meet, particularly around readmittance issues. Our current portfolio, on the left-hand side, you'll see these red or orange dots. So you're going to look at Vermont, New Hampshire, Rhode Island, Massachusetts. Those are locations we currently have. And in Nova Scotia, we have a Halifax-based office as well as New Glasgow and Kentville. This is a map that's in our office. I like to show this map to people because I think it demonstrates where we are and where we're going. So one, I would say that we're getting some decent concentration or depth in the states and in the province of Nova Scotia, and that's evidenced by the dark pins that are there. And you think that we're doing 17 million US in revenue, roughly 22 million in Canadian equivalent dollars, in over 2 years. But when I look at this map, I say to myself, look at the potential. I mean, look at the potential that we have to continue to grow across the states. And think about where we could be a decade from now. There's really nothing to slow us down. I don't believe in my lifetime I could ever run out of opportunities to acquire or expand across these two countries. I just don't think it's possible given the demographics. So we have a long way to go, and it's exciting times for us. I'll skip through a couple things for the breadth of the presentation. I will say, how do we acquire? It's a question I often get. So we're usually paying a fairly low multiple of EBITDA on the deals that we do proceed with. Again, we're looking at 10 to 15-year-old businesses. Generally, they're owned by a founder. The founder is looking for a succession plan, and so is sort of at the point where he or she is tired of running the business. Has a good operating team in place. The operating team is going to continue on post-acquisition. And is willing to work with us to enhance the operation through the use of technology and a bunch of other processes. So that's generally how we operate. We've been very fortunate to have Bank of Montreal has been funding us on the debt side. So because we're buying historically profitable businesses, they've been providing facilities, debt facilities, which has been extremely valuable for us as we've scaled up. It's really allowed us to ramp up quite quickly. The management team is, there's 4 of us at head office right now. So me, our CFO Megan, we have a corporate controller, and our manager of corporate development. There are 4 board members. Some of you here know Dana from his CFO Go Gold, Michael Keefe, who used to be in the resource space, and Wayne Miles, who's been a very successful entrepreneur in his own right and has a lot of M&A experience as well as home healthcare experience through the volunteer board chair for VON Canada. So 4 independent directors, 4 directors and 3 are independent. Our cap table, we've tried to keep it as clean as possible. 61 million shares outstanding. We're trading roughly around 24 cents right now, roughly a $15 million market cap, Canadian dollars. We've got the BMO debt on the left-hand side. Its demand loan shows up as current on our balance sheet, but has an amortization between 5 to 7 years. And we have a separate facility for the five separate facilities for the transactions that they've been involved with. There are large companies in the U.S. in particular that have had a lot of success with the roll-up strategy in the home healthcare side, particularly LHC Group, Amedisys, and Addus. Addus goes after or serves what we call the dual eligible patient, someone that qualifies both for Medicare and Medicaid, so a low-income senior would be a prime example. LHC Group has done a fantastic job with the joint ventures with large hospital groups in the U.S. I think they've probably been the best at that. And Amedisys has done phenomenally well with their acquisition program over the last 20 years. A stock that's gone from roughly 95 cents to $135 over a 19 or 20 year period. We're following a similar model, and really that's to buy good profitable businesses, open new locations, and repeat that process. We've got a great team. With the current team, we could push 8 to 10 deals per year before we have to hire. We've reached the point where we've scaled up really, really well. We've got a platform that works great, particularly in New England and in Nova Scotia, and we're now looking to replicate that platform in other parts of both Canada and the U.S. So that's Nova Leap. Very much appreciate your time. Thank you to those that have heard the story before. Happy to provide an update, and thank you once again.
If you enjoyed this video, please let us know. You've been watching the Richmond Club Report. If you've just come across this channel, please feel free to like and subscribe. I'm sure you'll find a lot of interesting and lucrative investment and trading ideas around here. We'll see you again soon on the next video. Cheers, guys. Have an amazing and profitable day.